Hello, welcome to COVID-19 Conversations with Memorial Health System. I'm Aimee Allbritton, serving as our Public Information Officer, and I'm here today with Diana Knaebe. Diana serves as the System Administrator for Behavioral Health and the President of our Memorial Behavioral Health. And Diana, you've been a long career as a behavioral health specialist, right? And moved into leadership after serving as the Division of Mental Health Director for the state of Illinois. Just joined Memorial earlier this year. We're glad to have you, especially right now during this time. So we're here today with Diana to talk about some of the emotional needs that people are having related to COVID-19. So we're just going to dive right in. So we're going to call it what it is. People are dealing with a lot right now. Unknown feelings. This is dramatic for our country and for individuals. Can you tell people what's normal emotions that they should be okay with experiencing right now?
The new normal, right?
Yeah.
Well, I think a lot of people are really anxious. I think sometimes angry, frustrated, confused, feeling overwhelmed, depressed. Maybe some people are crying, where that may not be typical for them at all. Fear, almost paralyzing fear sometimes.
So what do we do about it? If that's our new normal, that doesn't sound like a great space to live in all the time. What do we do about that?
Well, I think it's that balance, so I think we need to be informed. I think we need to make sure that we're looking at reliable sources, but we need to set clear boundaries. So we need to make sure that we're limiting the amount of time that we're spending online or watching TV or reading from whatever source about what's happening. So maybe you set, so in the morning you're going to take a look at what's going on, and maybe in the afternoon and maybe in the evening. I would suggest that most people try to set up as much of a routine as possible. And that they stick to that routine. So even if you're working from home or home and you may have kids, trying to get up at the time that you normally would get up, even though the kids may now be at home, and I think now school's back into somewhat of instructional kinds of things that may be a little bit different than what we've been at. Trying to get up at the same time, taking a shower, exercise is extremely important. You can do something in the house. I think now that it's nicer out, people are wanting to get outside. You may need to be checking with Parks and Recreations to see where are the appropriate places that you can go. You're wanting to make sure that you're physically distancing the way that we've been told is appropriate. And so keeping 6 feet apart from one another.
Like we are today,
Making sure that if you're riding your bike or whatever, that you're doing it either with people that you live with, but not with people. You're not running and meeting up with your former running buddies that you're not living in the same household with. You can keep track maybe on the internet of, I ran, 70 miles today. Keep encouraging each other, because I think that's really important of finding out who are those support people. And I think that's another piece, Aimee, is who are your buddies, who are your support people? And they may not be people that you're physically with, but they are people that you can call upon. Phone a friend.
Phone a friend, And so, that's one of the things I think people are struggling with. We have this shelter in place, and we're asked to follow these, what people perceive to be pretty strict social distancing standards. How do you socially distant? How do you do the self-isolation but not feel isolated?
Right. And for some people, if they're introverts, they may do a little bit better of it. For those of us that are extroverts, it's a little bit more difficult. Don't run out to your store. So chat groups, are there people that you share interests and hobbies with, that you can email with, that you could set up a chat group with? It may be somebody new. It may be that you have strong religious or spiritual beliefs, and now is the time to find out, who within your sphere that you might be able to have a collective conversation or an individual conversation with. I know there's lots of prayer lines out there, and for a lot of people that's really supportive. I think whatever is supportive for individuals is important now. It may be touching base with old friends that you haven't talked to in some time, catching up with them so that you're feeling, again, that connection. I've seen people where they're driving by and they're waving from their cars
Yes.
to,
Great.
teachers letting their students know that they're still thinking of them.
Well, we have a lot of people doing like virtual book club over Zoom or whatever that social thing is that they used to do one Wednesday a month.
Yeah.
Now they're doing it over Zoom so they can still connect with people.
I saw a mother with her 2 teenage daughters, and they decided to have an art at night thing at home, and so they were live casting on Facebook, and so they kind of talked about it at the beginning.
Opportunity to get creative,
and then afterwards they were showing their finished products.
That's
exactly.
Great. Yeah.
And I think that's a really good point. I think it's important to be creative, and I think a lot of the arts can be helpful to us in general.
Sure.
Coloring, we've known for a little while now that coloring can be very therapeutic for people.
Sure.
Journaling. Gratitude journal.
Okay.
I think thinking every day what we can kind of get in that negative mindset or so I think sometimes it's just that piece of, is there one thing that's a little bit better today than yesterday? I was able to sleep a little bit longer last night. I didn't wake up as scared today. I'm feeling a little bit better right now. And I think it really is kind of that, right now I'm okay.
Yeah. And it goes back to owning your feelings and recognizing them and knowing that it's okay to feel the way you do right now.
Yeah.
What if you have a family or friend, you said, reach out, stay connected with people. What if when you're talking to one of them, you have concerns about them, right? You talk to people and you can kind of tell where depression is setting in, where the isolation is really becoming a problem. What kind of signals should we watch out for to know that maybe that person isn't okay and needs some help?
Excellent question. People who, obviously, as we were talking earlier, our patterns, our routines may be off.
Yeah.
But if you get someone who's saying, I'm sleeping all the time, I just want to put the covers over my head, I don't even want to come out, I just can't deal with it, I'm crying all the time, I don't want to talk to anybody. When I do start to talk and people are checking on me, I get really angry, I'm lashing out.
And if those behaviors are not normal, right?
Exactly.
Yeah.
I just feel like I'm on edge. I'm actually having thoughts of doing something that would hurt myself. I don't feel like I even want to wake up tomorrow.
If we start hearing things like that, we know that person needs
I'm
help.
not eating.
So you actually have a number of resources that are available, and we want to share some of those with the group, because if someone is feeling that themselves or they're hearing it from others and they want to share those resources, can you talk a little bit about what's available to our community?
Memorial started an emotional support hotline. It is free. It is confidential. For the general public, for individuals that may work at Memorial. And I think it can be used so that if someone were concerned about a family member and what could I potentially say to them, I'm not sure if this is really something I should be concerned about or not. They could call on behalf of someone else to know kind of how should I act, what could I do.
Almost a coaching situation to walk through. Like, I'm going to call my mom and I want to talk to her. Can we role play that a little bit about what that would look like?
And
that's
so
a great service.
That's available from 8 in the morning until 8 at night.
Okay.
It's answered by clinicians that work here at Memorial.
Okay.
We can connect them with internal resources. We can connect them with external resources.
And anyone can use that. You don't have to be a Memorial patient, a Memorial colleague, anyone.
It's free, confidential.
And they can give it away to, like, if they have a friend in Colorado, like, we don't care where you live or what you do. Give us a call.
And then we also are part of the National Suicide Prevention Hotline, Lifeline, I think they call it. And so after hours, the calls roll over to that line. And our colleagues here answer that for the most part, unless they're busy, because it's part of our crisis stabilization center. And so if they're working with some of our patients in that setting, it may roll over to the national helpline.
Good.
And that's really geared towards helping people that may seriously be concerned themselves or with someone else.
And we're hearing that daily in our command center updates, that those are some of the calls your team is taking.
They are.
We thank you and your team for doing that, and it's just such an important service to have available to our community. So yes, we want anyone who needs that to be able to use it.
And then for some people, they may not really want to talk to someone, or they may be in a circumstance where they may not want the person that they're living with to know what's going on.
So I actually
domestic violence,
yes,
you know, is going to be on the rise, and some of those kinds of things. And so there's two resources that I would recommend for people who would want to text. And teenagers often prefer texting.
It's their style.
There's the crisis text line.
Okay.
It's a national line.
So that is this one here, the 741.
So that's 741-741, and they can text. And it's really great technology. They are geared towards looking towards keywords that might let people know. And so their calls are queued up depending upon what someone's saying. And then they also can connect with local law enforcement. So if they're really concerned that somebody is imminent, they can actually dispatch local law enforcement.
So that's actually one of the questions I was going to ask you, because just today, you know, we pay attention to what's going on social media and to make sure that we can respond and get information out. And one of the things we were picking up in our intel report yesterday was some people who were saying, I'm in a domestic violence situation, and now I'm with this abuser 24/7. I can't go anywhere. So what you're saying is those individuals could utilize that crisis text line to avoid the phone call and get the support that they need. That's
state
fantastic.
Also just rolled out, I think we got it yesterday, and so our folks on the emotional support line have that information as well, and we can make sure that we post it.
Sure.
There is now a line for domestic violence specifically. They're putting out some more money within the state. The governor's initiated that, and that came out through Secretary Ho at the Department of Human Services.
That's
so we'll make sure to get that out, so that because obviously, you know, for someone who's in a situation where they're now with someone who may abuse them, and obviously because there's more pressure, people may be drinking more than usual because they're home. Again, with those fears and so forth, and they may very well take it out on their family members or the people they're living with.
We're just in a heightened state, right? Just in general, everything about what we're doing is magnified, and that could be one of those.
Absolutely.
So I have two more questions for you. One is, when you've been talking to our teams around the health system, we've been talking about this idea of grief and loss, and that a lot of what people are experiencing right now mimics a lot of what happens in grief. Can you talk a little bit about that? And I know you actually had a situation with your family just last weekend that we were talking about. Can you share what people can do about this grief and know that it's okay to have that?
It's really that when we were talking about some of the normal feelings, I think the whole piece of grief and loss, they can Google David Kessler. It's grief.com. He was a mentee of Elizabeth Kubler-Ross, who is kind of an international person in grief and loss. And I think so many people, I mean, as you were mentioning, I mean, my family, we were supposed to have a multi-generational get-together for last weekend for a school play that my 14-year-old son was going to be in, and that got canceled, and so we had to cancel all the plans, so we didn't get to see, you know, extended family. Weddings are being postponed.
Well, and Easter
coming
up,
yes,
right? It's
and
be
we don't want
different.
people to be, you know, going out obviously and gathering. We have to do it virtually and all kinds of things, and graduate proms,
and
graduations, and graduations and all kinds of things where we just don't know.
And it's okay to feel that grief.
Absolutely, we don't want people to stuff their feelings. This is not the time to stuff feelings.
Well, I think it's important too, as you were talking about, that what people are grieving over may be different. So we do have people who have, you know, there's been funerals and weddings and things that have been canceled, and then there's things that others could perceive to be smaller. And what you want to be able to let people know is, if it matters to you, it matters, right? Doesn't matter how big it is or who else is impacted.
And sometimes I think that's when we, in therapy, when we do support groups, sometimes something that's helpful is, I'm kind of really upset about the fact that I didn't get to be with family last weekend, but I will get to see them at some point. And so someone that I'm aware of who's just lost a loved one for whatever reason, their grief is very different, and that's lasting. That's not going to be temporary.
You can have different grief, but all the grief can be okay, right?
Yeah. And some of it's the building.
It is.
You know?
It is.
And so there can be multiple things that happen.
So, last question for you is, we're seeing right now what I would describe as a pretty significant dichotomy between people living in our world. You are either one of those roles that is an essential role, healthcare workers and people working in grocery stores and pharmacies and doing the drive-thrus at the restaurants and people who are out there doing our community services, you know, whether that's electrical or garbage or whatever those things are. Those people, we're kind of living one world, right?
Yes.
With this heightened sense of everything. And then when you go home, the people that are there, oftentimes they're isolated, they haven't been out in a long time, they're adapting to new ways, they're all together and they're not having any alone time. So to help out our healthcare workers here and to help the people supporting all of them and all those other essential employees, what advice do you have to both sides of those people? How can I be better when I go home? How can my family better support me when I get there so that we can manage that on both ends?
Wow, that's a really good question and a big question. You know, in any given day, depending upon what your day's been like, you may be a different person today. The circumstances may be very different. I mean, for colleagues who had very rude people they were working with, or, I mean, customers, you know, that are coming in, and other people, you may have had real support. I mean, I've seen communities where, and just kind of on Facebook, people that I know that are working in healthcare and the, you know, the streets, people are, you know, signs and they're cheering them when they leave in the morning and, you know, when they get home. But for some of us, we may need to take off the clothes. We may need to decompress a little bit. So some of it may be, how do we communicate with those that we live with what our day was like? And it may just be trying to take a couple deep breaths maybe before you actually walk into the house. And I think saying, I just need a few minutes. Please just give me a few minutes. That's how you can help me right now. I know we've had very different days, but I just really need to breathe. I need to be by myself for a few minutes.
And what about those of us that are going home to the people who have been isolated all day and they're like, "Yay, you're here, we want to talk." What can we do to help them through the challenges they're facing at home?
Well, and I think it really is incumbent upon us all to communicate a little bit better and a little bit differently. So it may be, okay, I'll give you a few minutes, but I really have something I really need to talk with you about. Or I had a really rough day at home today too, and I really could appreciate talking with you about it. And so we're having to share, I think,
and
a little
honor
bit more
how the other person feels. Like
excellent
whether
point.
you're at home going through the changes or on the outside going through the changes, both of those are valid.
They are valid,
right?
Yes,
and so trying to understand a little bit more. I guess if anything good can come out of this situation we're in, it is some of the things you're talking about. People communicating better, getting in touch with how they feel better, and knowing what resources are out there in their community.
And we're going to make mistakes. We're potentially going to say something in a tone of voice or say something. So I think the other part is giving yourself and family members
grace.
Some grace, exactly. And then acknowledging and apologizing, I think.
Yes.
You know,
that's great advice.
I'm sorry, I didn't mean to act out. Let's talk about it. Or it may be, I'm really emotional right now. I know that what I said wasn't in a kind way, but I'm not at a point right now where I can talk about it. I need.
So I need to go over here
so
and I'll be
let's
back.
Give me a few minutes, but I realize I wasn't the person that I'd like to be.
Yeah, that's a great way, to say it. So what we want to do is let you know that we have a new resource that is being shared along with this video, and it is essentially saying we understand, right? If you need to talk to someone about if you had to cancel your baby shower, the trip you've been planning for months, changes in what's happening with your employment and your job, changing things about who can be with you when you're delivering a baby, right? Those things have changed. If you're trying to understand how you deal with COVID-19 with other health concerns you have, or as we just said, staying home for a long stretch of time, we live in a pretty overscheduled society where
Yes.
people are always on the go. This home thing is a whole new world,
is,
right?
it
So
is.
any of those things they need to talk about, they can reach out to this 217-588-555-509. I want to make sure we get that right. And our colleagues at Memorial Health System are here for all of you. Our mission is to improve the health of the people and communities we serve. That is not only your physical health, that is your behavioral and mental health as well. So Diana and her team are here for you.
Absolutely.
Give them a call if you need it. Thank you so much for
Thank
being
you,
here
Aimee.
today.
Really appreciate it.
Yes.
Please take care of yourselves out there. It's important.
Yes. Thanks for being here on our COVID-19 conversation about emotional support.